Hi there, and welcome to another episode of Health with Dr. Yvette Masaka. This is a podcast that aims to correct myths around health. And today we're going to be talking about a very important topic. We'll be talking about cerebral palsy. And today I'm joined by Dr. Crispin Kalikit.
Yeah.
Right?
Yeah. Yes.
Welcome.
Thank you. Thank you.
Um, Dr. Crispin, tell me about Kalikiti. Yes. Was it so obvious? I was
Okay.
about to
Yeah.
say Dr. Kalikiti, then I wanted to say Crispin, but Crispin is much easier.
Okay. Yeah.
So can I stick to Crispin?
Yeah. Yeah. Crispin is fine.
Thank you. So tell me about the app that you've developed.
We're looking at the dynamics of where medicine is going, right? So we've been working on an app that is targeting at making life easy, to access medical doctors and practitioners alike, right?
Okay.
So it goes by the name Polenimed, right? So the target group obviously is people that have busy schedules and anybody else that doesn't want to be in that fracas of long lines at hospitals, so that we make things easier for you, and also just to pass knowledge to people faster, you understand, rather than having to wait for months to understand the condition also.
Okay, that's interesting. And it's functional?
Yes, it's functional, but as of this week, we've been down, but we'll be back starting Monday.
So I'm curious, how does this work? Is it via messages? Is it via video? How is it
Yes,
done?
so as it is right now, it's more of a booking management online system, right? Yeah, so we do not have any virtual presence in which, how do I put this, where you have real-time video messaging with a doctor. Not yet. It's something we're still working on in the pipeline, but you can book with doctors that are affiliated to the app. So how it works is we have institutions, medical institutions that are affiliated to the app, and then they will put their doctors online who you can access in real time or offline. Yeah, so basically you can book for a clinic with their particular institution.
Okay, that's really good. It's now a digital world, eh? Everything is digital. That's really good. You're moving with time. Yes. So the topic of discussion today is cerebral palsy. And cerebral palsy by definition is a disorder of movement and posture. So for a layman out there, how can you break it down to simpler terms?
Okay, so for the layman, right? So, anyways, let me start with trying to outline the importance of cerebral palsy, right? So, this is something that is in our community. And a lot of people may not understand that the person they're looking at is actually somebody suffering from a cerebral palsy. So, what does cerebral palsy mean? Okay, so cerebral comes from brain. Palsy is simply to do with um, loss of certain motion, isn't it? Yeah, so that is where we can start the topic from. So, how would I make a layman understand what cerebral palsy is? Okay, so we've seen a lot of people that may have certain movement disorders. Okay, some are affected with only one limb. It can be upper, it can be lower. Okay, some have complete loss of function of all limbs. So normally they'll present as people with I don't know how best we can break down and say spasticity, but these are people that are normally spastic.
Yeah.
They've got very little motion or function.
Maybe we can use rigid.
Yes, so they'll
Yeah.
appear rigid, right? Yeah, so that's basically cerebral palsy, I think, for a layman to understand. So, from the definition, it's a movement disorder, right? So, what do we mean by movement disorder? So, the best thing is, where do we start from? Okay, how does cerebral palsy come about? So, we can break it down into 3 points at which you can have a defect to, so it's like a defect to the brain, right? Yeah, so it can happen at 3 phases. So one is prenatal, which is as the baby is developing. So this is in the womb, right? Then you have during the perinatal phase, okay? And you have a postnatal. So from the terms, pre is to do before birth, perinatal is during the period of birth, and then postnatal is after birth. So what things can cause a prenatal, right? Which is at this point where the baby is still developing in the fetus, in the uterus, as the fetus, right? So you've got infections, you understand, some genetic factors, okay, just to mention a few. Then we can go to the perinatal phase. Okay, this is during probably at birth. Okay, so when the baby can suffer from asphyxia during delivery, those are some of the things that can lead to injury. Okay, so basically the bottom line is there's some form of injury to the brain. All right, so we've got another example we can use: babies that may be premature and then born, not born via cesarean section, where they may be more careful, but born via normal delivery, right? So these are smaller babies with very soft cranium, and then they may also suffer injury to the brain. So like I said, bottom line is injury to some part of the brain, which will lead to these movement disorders. So normally they will affect muscle, right, at most of the presentation of these patients. Yeah. And postnatal, of course, these things can come as a result of, normally this comes at early birth, early childhood, not early birth, early childhood. Yeah, so infections that children may suffer from, in their early livelihood, that have impact on the brain, can cause some damage, will lead to some of these presentations of loss of movement and locomotion of a child.
Yeah, that's true.
Yeah. So I do not know if that is at layman's level.
Yeah,
so,
well,
in
it's
brief.
clear. Basically, to just rephrase what you were saying, it's just injury to a developing brain.
Exactly.
So, yes. So, this is why we're always emphasizing that pregnant women always go for antenatal, because there's some infections that we screen for during antenatal. For example, we're going to screen for hepatitis B, we'll screen for things like syphilis. Yes, all those things can affect
even just
the baby's brain.
other non-communicable diseases like diabetes, you've got your hypertension. All these are factors that need to be
even
managed.
anemia, because
Yes, even
if the baby is not receiving enough blood, meaning the brain is also not receiving enough nutrients to develop, so that can also cause injury.
Yes, can lead to some hypoxic brain injury, meaning just low oxygen.
Low oxygen.
And
So,
nutritional.
yeah, even during birth, as you said, asphyxia. Maybe someone out there doesn't know what asphyxia is. But basically, there's some instances where, for example, sometimes the cord may be very tight around the baby's head. So the brain isn't receiving enough oxygen. That's asphyxia. Or maybe the baby's head is big and it just gets stuck.
Yeah, so
especially
prolonged
like in
labor.
so especially like in breech,
Yes, breech
where the
as
baby
well.
is coming out with the bums.
Yes.
And then the head just remains stuck in there, so that could also cause
Yes.
cause asphyxia.
Under perfusion to the brain.
Yes. You're not receiving enough oxygen. Then during after birth, anyway, during infancy, you have infections, as I mentioned, infections like meningitis that could be caused by things like TB. You have things like herpes causing all those things. Syphilis will also cause that. Gonorrhea, all those funny infections can cause meningitis.
Yeah,
Then
even a malaria as well.
yeah, even a malaria.
I've
I
seen
mean,
quite a number of
we have cerebral malaria.
cerebral malaria. Yes, seen a lot of children that have developed these palsy disorders because of malaria. Yes.
Then jaundice as well.
Yes.
Jaundice is basically where your baby is looking yellow. And saw a patient who came from one of these rural areas, and the baby was jaundiced. Beautiful baby. So the baby was jaundiced, and he was around 9 months. He couldn't hold his head up.
Yeah.
He couldn't sit. Yeah. He couldn't even cry, unfortunately. So we talked to the mom, and she said, "Oh, the baby was yellow. Like maybe 3 days after birth,
Okay.
the baby was yellow." And apparently, people in the community just advised her to put the
They
baby
overlooked it.
under the sun. Yeah, like just sit with the sun, with your baby in the
The
sun.
sun, yeah. So maybe a misconception from what we do in the hospitals where we
Yes.
use UV light and so forth. But that's a special type of
Yeah, a special type of light
yeah,
that
special type of light.
that helps break down that jaundice, because it's harmful for the brain. Yeah.
Exactly, yeah.
So, what are some of the different types of cerebral palsy?
Okay, so cerebral palsy, okay, like from the medical aspect, is broken down into three basic types, okay, which is one, you have your spastic type, okay, which I think we had talked a bit
Yeah,
about, where
where
you have
you're
got
rigid.
stiffness of your muscles and so forth. Then you've got the dyskinetic type. Of course, dyskinesia, we're talking about these involuntary movements. So there's uh, a defect in uh, we need to cut that out.
There's a defect in the what? In the
In the
I don't know
basal
what.
ganglia. All right. So in
Yeah,
the
there's a
yeah,
defect
so
in the
there's a
basal
defect in the
ganglia.
basal ganglia. So there will be this dyskinetic. So there will be motion issues with coordination and motion, right? Then we have the ataxic type. Okay, the ataxic type, this is where patient will present more flaccid than normal, right? So they can't
Yeah.
really control. This is normally coming from the cerebellum, which is helping our our locomotion, movement, and balance. So once you have a defect there, all right, or an injury which stemmed from the things we talked about earlier. So these are normally, so what will happen is all these conditions will come as a result of a certain part of the brain that is injured. And normally we'll see this in the cortex, okay, which is the upper part of the brain, which controls motor function. Then you have the basal ganglia, which is the stuff that is, at the kind of at the mid part to the basal part of the brain, which controls quite a number of things. And we have the cerebellum, all right, which is at the posterior part of the brain and controls movement and so forth. So each injury to each of those parts, the presentation of how the patient will present with cerebral palsy will tell which part of the brain it can be. So we also have a mixed type where you can have all these features of a patient where they can be both spastic, right, and they can also have features of also some flaccidity as a result of maybe ataxia, and also have dyskinesia as well.
Okay.
All
So
right.
does chorioathetoid fall
Okay.
under dyskinesia? Is it different?
How would we put it? Yeah, I would put it, yes, under a form of dyskinesia.
Okay. So chorea is where they have like dancing
Yes, so
movements,
there's
yeah?
that, we're talking about that involuntary kind of.
Yeah, involuntary, like
Yes, so
dancing
it's more
movements.
of the basal ganglia
Okay.
associated.
So
Yeah.
it's under the dyskinetic type. Okay. And so what are some of the features that parents out there can look out for in
Yes.
their children?
So this is one thing I'm interested in mostly, right? I'm not a specialist per se in this field, but I tend to uh, gravitate towards this condition because I worked a bit in NICU and in children's ward from my former institution, where I learned to see that this is actually a real problem. All right, a lot of parents do not understand what cerebral palsy is, and then we've got a lot of misinformation out there. So it's one thing that I really like to push so that we get this message out there, so that we can be able to identify children early and also bring in management early to these patients so that we improve their livelihood at least as they grow. So things that what was the question again before I messed up?
No, no, you're doing fine.
Okay.
I was asking about the things to look out for in your child.
Okay. So things to look out for in the early stages of life, right?
Mm-hmm.
So we've got milestones that you need to look out for. So if a child is unable to hold their head, right, let's say after a period of 3 months, for example, right? So you need to look out for that. Delayed speech, all right. So you need to at least have a good idea of what milestones to expect.
Yeah, and these milestones can be found on the under 5 card. So, yeah, it tells you when your baby should start walking, talking, sitting, all those things. Mm-hmm.
So again, another thing we need to advise people is the under 5 clinics are very crucial. Yeah, so they will teach a lot and they will help you assess your child at which point they are neurologically, right? So there are a lot of neurological things that you can look out for. We've already mentioned things like delayed speech, uh, of course, the spasticity, right? The rigidness of the legs. Uh, what else did we mention?
We've mentioned the head lag where they can't
Yes,
control their
they can't
head,
control their head,
delayed speech,
delayed
delayed
speech,
walking.
yes, drooling.
Mm-hmm.
Okay, so these are things that are very vivid, right? Majority of the times you'll be able to tell there's something wrong. And I think this is at the point where you really need to seek medical advice. All right. Okay, so that intervention is done in good time.
Okay. So, what are the interventions that you put in place?
Okay, so cerebral palsy is a multidisciplinary condition.
Mm.
So we're looking at, because there are a lot of other factors that will come as a result of brain injury, right? So people can develop convulsive disorders like epilepsy over time, right?
Mm-hmm.
And also these same spastic conditions we're talking about, the rigidness, right? So these are things that can be helped by physio, all right? These are, you can use medications to help the spasticity, right, to ease in the muscles.
Mm-hmm. Even
Okay,
surgery sometimes.
sometimes you can also have surgery where
Yeah.
they can sever the nerve in certain areas where there is hypertonicity and so forth, right? Yeah, I do not know if that's being done here, but yeah.
No, I think for here, what they do is tendons.
Oh, I'm
Yeah.
not too sure. I haven't yet come across that surgical management, but I'm very
Yeah, I'm
sure
also not sure.
on the physio part. Physio is doing very well with managing of these patients, and neuro clinics. I think there's also been a better awareness of in the past few years now. I think, yeah, there's more attention towards cerebral palsy. Yeah, so there's intervention with a different number of drugs depending on the condition that the patient will present with, so that we ease in their life. All right,
Yeah.
and there's things like speech therapy, right, which can help them, you understand, if started early, of course. Yeah. um what else could we talk of? Again, physio. Then we can also talk about the fact that they normally have difficulties feeding.
Yeah, they do.
Okay, so when intervened early, they can be taught early to feed, how to try to feed themselves in good time.
Yeah.
Yeah, so again, a lot of them, like I said, tend to have epilepsy. Again, you can use drugs for that. Then you can also teach parents on how to monitor those children.
Mm-hmm.
Yeah.
And feeding is really an issue when it
Oh
comes
yeah,
to.
that before I forget, nutrition again. So you
Yeah.
need a nutritionist at least. Yes. Uh-huh.
That's where I was actually
Oh,
going when I said
yeah, yeah.
feeding. Yeah, because it's an issue.
Yeah.
Some of these patients find themselves in the malnutrition ward, not because they're not being fed, but it's because of difficulties.
Yes,
As we said,
swallowing,
yeah,
muscle issues.
muscles. Swallowing requires muscles,
Yeah.
and most of them have challenges with swallowing. So
Yes.
you find that because they're unable to swallow, some of the food even ends up going into the
Yes.
windpipe, and then
Just
that
fix
brings up other
pneumonia.
complications like
Yes. Aspiration
pneumonias.
pneumonias. Yes.
Yes, so they find themselves in and out of the hospital. So parents are supposed to be taught how to feed the baby. And I'm really glad that here we have a center that
Yeah.
makes like special chairs for them,
Yes.
where they can be strapped into this chair and they can be in a standing position, and you
Yes.
can feed them other than them just lying down. So yes, there's indeed more awareness when it comes to cerebral palsy.
Yeah. And talking about chairs, there are a lot of other physical modalities that are being made now, which will help support these children. I saw something very interesting, I think about a year ago, where, because majority of them also develop difficulties in passing information, right? But they're able to move one or two limbs, yeah?
Yeah.
So there's this chart. I've forgotten what the pediatricians are calling it, but you have a chart where you have different foodstuffs, so on and so forth. Then you have a child point at what they want, be it water, be it food. I think that is something very innovative,
Yeah.
and can really help out, especially in communication of a cerebral palsy child.
The thing about cerebral palsy, it affects, okay, from what I've noticed,
Yes.
in our setting, it affects people with low socioeconomic status. Like most of them, not all of
The
them.
badly hit ones.
The badly hit ones, yes.
Yeah.
There are people who, they can't even afford to take the child for
Under five.
under five.
Neuro clinics. They
They
look
can't
for a speech
afford.
therapist
They
and
can't
so forth.
afford all that.
Yeah.
Because with that time, they need to start looking for money.
Yeah.
They only come to the hospital when the baby is sick. Maybe the baby has a pneumonia, or the baby now has seizures that are beyond their control.
And then just to touch more on what you've said, there's also this stigma around cerebral palsy children, which is very heavy again in a in the setting of course, in the outer skirts, in the peri-urban and outer urban areas. Yeah, so I think that's one thing that I have been trying to push in my in my small capacity. Yeah, it's just to try and raise awareness so that it can even at least touch people a bit further.
Yeah.
In those areas like you were pointing out, because majority of the times what will happen is they do not want their children exposed because of what society will say to them. So things of witchcraft associated with why their child is like that. But then some of these things are almost all the time explainable if you really look at them.
Yeah, and unfortunately, some people also, some of them tend to have this, I'll call it kind of, some of them have this hate towards the child, and I've seen this before. And when you talk to these mothers, they tell you, no, my marriage ended because of this condition, and my husband said this is my fault, and he now has another wife.
Yeah, so I think we still need to do a lot of work in terms of teaching more about the condition. I think it would help a lot in our societies, because like you are saying, there are those kinds of issues that arise, and then the more we educate these mothers, the more we likely have a better outcome on how they'll manage these conditions, because a depressed mother is not the best mother to manage a cerebral palsy patient, because they are quite a lot of work. Yeah. So,
It's not an easy thing. They have a lot of hospital visits. They're in and out of hospital.
Yeah, so it's important to strengthen the mind of the mother.
Yeah, sometimes you may strengthen the mind, but the pocket doesn't allow. They can't.
Okay, but the basics, at least if we can afford to offer the basics, even from our government hospitals.
Yeah, but I think what we
fine.
can also do is maybe teach the mothers some of these skills, like how to do physio, at least
Yeah,
simple
simple physio
movements, because
movements. Yes,
some of the children come so rigid, like you cannot move
yes,
any limb.
yes, and some of them will even develop contractures in the
Yeah, they
process. This
develop
makes it
contractures, and for
even
those who
more
don't know
worse.
what contractures are, basically very tight tendons.
Yes.
Yeah, where you can't move. Like when someone has a burn, yeah,
Mm-hmm.
and it heals over a joint.
Yes.
Yeah, that's a contracture.
Yeah.
Yeah, and some even develop pressure sores
Yeah.
because they're sleeping in one position for a very long time.
Yeah.
Yeah, and they end up having these pressure sores, and then these pressure sores become infected,
Infected. Yeah.
and then now that infection goes into the bloodstream and they come with sepsis.
Mm.
So there are many complications when it comes to
Yeah.
cerebral
Cerebral
palsy.
palsy. Yeah. So that's why the multidisciplinary thing is really the gold standard management.
Mm-hmm.
Yeah. Oh, and the other thing we need to emphasize on that maybe a lot of people may not know out there is some people may think if in the early stage especially it may be reversible.
Yeah,
So cerebral palsy as it is
it's
not
irreversible. Yeah.
treatable in that sense where you can reverse the condition. So I think it's something that we need to stress so that even as we approach managing the patients, we know that we are just improving their livelihood as much as possible.
That's true.
Yeah.
So, what are some of the measures that people can take out there to prevent having a baby develop cerebral palsy?
Of course it's hard to really say,
Mm-hmm.
but majority of the patients that we've seen or people that have done antenatal have had a lesser outcome of problems associated with
Mm-hmm.
having developing cerebral palsy as a result of maybe delivery injuries,
Mm-hmm.
infectious causes during in the antenatal phase, so my what English would we use here? My advice would
uh,
be all mothers need antenatal.
yes, and no
Yes.
home deliveries, please.
We try to stay from home deliveries as much as possible.
Yeah,
Yeah.
please, because
Mm.
some of the things they use are not, properly cleaned.
Yes.
Your child may end up,
Infection. Yes.
may
Yeah.
end up getting an infection, a
Mm.
meningitis.
And then develop a brain injury.
Yes,
Yeah. So,
because the brain is very fragile at that point.
yeah.
If an adult gets an infection, it really takes a long time for it to, like
Yeah.
impact you, like the way it impacts a developing brain.
Yeah.
Yeah.
So one of the other issues that we also need to strengthen on the health part is also we need to send a message quite loud,
Mm-hmm.
right? To really put this out as a real problem. Because majority of these related cerebral palsy cases
Mm-hmm.
will stem from poor management between the time of in conception to at least majority of the time after birth.
Mm-hmm.
So this is more or less like the critical period. If we're able to really improve this both on the maternal side and also on the clinical side, being
Yeah.
able to assess patients early enough, deliver them early, do early scans,
Mm-hmm.
look out for congenital deformities early enough so that we prevent these conditions.
Yeah, and also on the clinical part, I like that you mentioned that if we identify a baby as someone who may potentially have meningitis, we need to adequately treat the meningitis, because sometimes it's not just that the meningitis wasn't treated at all. Sometimes it also comes from partially treated meningitis. Like you may have given medication, but maybe the medication wasn't enough. And sometimes lumbar punctures are recommended when a baby has meningitis. And of course, there's this um there's this notion around lumbar punctures that yes, because a lumbar puncture will tell us what kind of meningitis we're dealing with, If it's bacteria, the lumbar puncture will tell us which antibiotics can be used. Yes, so that we treat adequately, because sometimes we may just be shooting in the dark. We may be giving an antibiotic that is not even working. So we also need to educate people on the lumbar puncture, because it could be the difference between life and death.
Yeah.
And some people accept the lumbar puncture when they see that things
When
are
it's too late.
yeah, things are bad.
Those
That's
are the
when they
worst.
accept the lumbar
In my
puncture.
personal experience, they're the worst.
Yes, because
Yeah.
I mean, you even as a clinician, you can't say, okay, guys, it's too late.
Yeah.
You can't play God. You're like, okay,
True.
let's just do this.
Mm.
Let's try. I'll do my best, and then leave the rest to God.
Yeah.
Yeah.
Yeah. Another take home is don't keep babies at home. You see a problem, you come to the hospital, go to a clinic. They are there for a reason. Whether we are bad in how we treat you, still come.
You're bad. No, we'll improve.
Yeah, so not because certain people have had one bad experience with one person, that doesn't mean every time you always find that person.
Yeah,
So it will scare off people, and then
that's true.
I would advise still come, because it's your facility, it's your institution. It will help the child.
Yeah, I'm going to ask you a very strange question.
Okay.
Have you watched Breaking Bad?
No.
No, okay. For those who've watched Breaking Bad,
Yeah.
the son to Walter has cerebral palsy. Like, he has slurred speech and he moves on crutches. Like, he really has cerebral palsy in reality.
Oh, okay.
But
now I feel like I have to watch.
yes, but he's able to communicate. He's able to move on crutches. He's independent. He can do things on his own. So that requires early intervention.
Yeah, that's a good example.
Yeah.
Yeah. No, actually, in in the Western world, they're doing quite very well in terms of managing these conditions that come as a result of injuries to brain early. Yeah, so I think we can also do it.
Yeah, they do pretty well with
Yeah.
these conditions.
Yeah.
Recently I saw a girl with Down syndrome
Yeah.
become an air hostess.
Wow.
Yeah. They're really
Wow.
teaching them how to be
Yeah.
independent.
Yeah.
But of course, there are different degrees of cerebral palsy.
Of course, yes.
It
Yes, a
hits,
spectrum basically.
yeah,
So
it hits
patient
some of
will
them
have
badly.
differently.
Yes, others like mild, others it hits them badly. So just because someone with cerebral palsy is able to walk and talk doesn't mean that another person with cerebral palsy is going to do that.
Yeah.
Which is unfortunate.
Yeah, but at least we can still try to make their life easy, at least better. So we prevent those things we're talking about, like the aspirational pneumonias. If we're taking care that, yeah, and the infections that will arise from bed sores and all the other things around
and
it.
also the medication. Like you said, some develop epilepsy, but the more they have seizures,
the worse they'll become.
The more damage. And some of them, if they're not going for physio, they start having these bad muscle cramps.
Yeah, muscle cramps and even just atrophy of the muscle. You don't want that. Yes.
So those need medication and physiotherapy. So it's very, very important. Although it's really not an easy condition to deal with.
Yes.
As a parent, it takes a lot of acceptance.
Yeah.
It needs a lot of support, especially from the loved ones.
Yeah.
Yeah, because it's both emotional
it's
and
quite wrecking emotionally for sure.
Yeah. Emotionally damaging, physically damaging, because some of the women have to, and mostly it's the women that we see with coming to the hospital with these babies. There are some men, but mostly women.
Niano would actually encourage the men to support the women.
Yes, please.
Support your wife, support your woman. Yeah. At least it will help
They
them
need
psychologically.
Some of them come with, cerebral palsy babies. You can tell, like, okay, this baby is big.
Yeah.
Some of them be like maybe 12, and they would have carried them on their back from wherever. Some of them will walk from maybe Kanyama or Chibolia walk to UTH just to bring that child for a medical checkup. Some of them are really, really good, like
Yeah.
with medical checkups and getting medication.
Yeah.
And then there are some who just lock the children up in the
Those
house.
are the ones I think we really need to speak to. We need to get out. We need to get them out.
Yeah.
Yeah. So, um, also we need as a people to support these groups. You know, that there are quite a number out there that are really trying to put in mechanisms that make life easy for a lot of these people with these conditions like cerebral palsy. So I'm part of an organization currently also running something similar. So they have a good team of specialists who, of every so often, right, who use their specialty, right, to address to these conditions. So we have a few doctors here, we have a few physiotherapists, we have a few nutritionists. So from time to time we'll go out in the outskirts, yeah, and then we'll see these patients and then address them, attend to them. If they need special hospital care, we push them into the system, so on and so forth. But of course it's challenging, it's out of people's pockets, but then
Yeah.
if people can, like, you know, see what these people are doing and try to help, I think it would also be good for such a society to grow.
Yeah, it would
Yeah.
be good to help them, because some of them will really tell you, like, look, I love my child,
Yeah.
cerebral palsy or not,
Mm.
but I need to look for money because my child needs
Yeah.
diapers. I
Mm.
need to buy the medication.
Yeah.
If they are maybe on NEMA, I need to pay for NEMA. I need to do all this,
Mm.
and I can't just sit home taking care of him. I
Yeah.
need to work.
Yeah. And a lot
Yeah.
of them keep coming in, like you mentioned, this a nutritional issue, malnourished a lot of times. Yeah,
Mm-hmm.
so a lot of them are dying from malnutrition.
Yeah,
Yeah, more than anything.
which is really
Sad,
unfortunate.
yeah.
Yeah.
And yeah, of course. Anyway, yeah, yeah. The
Yeah.
country overall is not in a very good state. Yeah, but then yeah.
Yeah.
But I think as people we can help each other through societies, churches. I think if we had focus on the correct things, these are things we can address.
Yeah.
Yeah.
That's true. Thank you so much for coming through and having this conversation with me.
Thank you.
This was a conversation that people needed to hear.
Yeah.
And I hope we can have more conversations like this.
Yeah, I think we do need to.
Yeah.
And my camera presence needs to improve, obviously.
Yes, we'll gladly have you again.
All right. Yeah.
Thank you so much.
All right, you're welcome.
All right. Thank you guys. Don't forget to like and subscribe. Bye.